You might think hemorrhoids are embarrassing, or just an annoying part of life. But what if I told you the real danger isn't the itch or pain, it's what people don't check for when they see blood? Today we're breaking down the hidden risk behind hemorrhoids, how to spot danger early, what treatments really work, and when bleeding becomes an emergency. If you've ever wiped and seen blood, don't panic, but do listen closely, hit subscribe, and let's get into it. What are hemorrhoids? Hemorrhoids are swollen vascular cushions in the anal canal, basically veins that become enlarged from pressure. There are two main kinds: internal, inside the rectum, and external, under the skin around the anus. They're extremely common. Many adults will experience them at some point. The most dangerous thing. Here's the short answer. The most dangerous thing about hemorrhoids isn't the hemorrhoids themselves. It's ignoring rectal bleeding and assuming nothing else could be wrong. Explain. Rectal bleeding can be caused by hemorrhoids, yes, but also by polyps, inflammatory bowel disease, or colorectal cancer. Delay in diagnosis can cost you crucial time. Medical authorities recommend evaluating unexplained rectal bleeding, especially in people over 40, with appropriate exams, and in many cases endoscopy, to rule out more serious causes. How hemorrhoids themselves can become dangerous. Host. Even if bleeding is from hemorrhoids, complications can happen when they're left untreated or when people try risky home fixes. List and explain, each with a short dramatized reenactment/B-roll suggestion. Thrombosed hemorrhoid. A painful blood clot in an external hemorrhoid. Intense pain, swelling, blue-purple lump. May require urgent procedure to remove clot. Strangulated hemorrhoid. Prolapsed internal hemorrhoid trapped outside the anus, so its blood supply is cut off. Severe pain and risk of tissue death. Chronic blood loss, anemia. Repeated bleeding over time can cause iron deficiency anemia, fatigue, dizziness, shortness of breath. This is a slow, overlooked danger. Infection and abscess. Rare but possible. Infection can escalate and, in very rare cases, lead to systemic infection. What symptoms mean: see a doctor now versus try home care. Here's a practical split: what you can try at home and when to stop and see a pro. Try home care first. Safe to try for short-term, mild symptoms. Warm sitz baths 10 to 15 minutes several times daily. High-fiber diet and psyllium fiber supplements. Plenty of fluids. Avoid straining. Avoid long toilet sitting. Over-the-counter topical creams or pads for symptom relief, short-term. See a doctor promptly if you notice repeated or large volume bleeding, or blood mixed with stool dizziness, fainting or signs of anemia, ongoing fatigue, paleness. A very painful lump, possible thrombosis, or fever, possible infection. A lump that won't reduce or is worsening, possible strangulation or prolapse, changes in bowel habits or unexplained weight loss. These could be red flags for more serious disease. How doctors diagnose the cause of bleeding. If you go to the clinic, here's what to expect. Explain common diagnostics in simple terms. History plus physical exam. Physician will examine externally and may use a gloved finger, digital rectal exam. Anoscopy/proctoscopy. Quick office procedure to directly view low-lying sources like internal hemorrhoids. Flexible sigmoidoscopy. Colonoscopy. If bleeding is unexplained, recurrent, or if you're at risk for colorectal disease, endoscopy is often recommended. Colonoscopy is the gold standard for investigating rectal bleeding in many adults' treatments, from home remedies to surgery. Treatment depends on severity and type. Break into tiers. Conservative care, first line, fiber, fluids, sitz baths, stool softeners, topical symptomatic agents. Many mild cases improve this way. Office procedures for persistent internal hemorrhoids. Rubber band ligation, banding. Most common, places a tiny band around hemorrhoid base. It shrivels and falls off. Quick outpatient procedure, sclerotherapy. Injection causing scarring and shrinkage, useful for certain grades. Infrared coagulation. Heat-based scar formation to cut blood supply surgery for severe or recurrent disease. Hemorrhoidectomy, open or closed. Surgical removal, high success but more post-operative pain. Stapled hemorrhoidopexy, less painful recovery but higher recurrence risk and specific complications. used for certain internal prolapses. Doppler-guided artery ligation, targets hemorrhoidal arteries, option for select cases. Recovery, prevention, and lifestyle. If you've had a procedure or want to avoid them in the first place, here's what helps. High-fiber diet. Aim for fruits, vegetables, whole grains, plus supplemental fiber as needed. Hydration. Regular exercise to reduce straining and constipation. Avoid prolonged sitting on the toilet. Respond promptly to bowel urges. Don't hold it. Post-procedure. Follow wound care, stool softeners, and follow-up visits. Recovery timelines vary by procedure. Common myths and FAQs. Quick rapid fire with on-screen FAQ text. Are hemorrhoids a sign of cancer? Usually not. Hemorrhoids are a common cause of bright red rectal bleeding. But bleeding should not be automatically assumed to be hemorrhoids. Evaluation rules out cancer and other serious causes. Will hemorrhoids go away on their own? Many do with conservative care, but persistent, recurrent, or severe cases need medical attention. Is surgery the only cure? No. Many treatments exist, and surgery is reserved for severe, recurrent, or complicated cases. Hemorrhoids themselves are often not lethal, but what makes them truly dangerous is what you might miss if you ignore bleeding or new changes. If anything here worried you, make that appointment. Early checks save lives. Like, subscribe, share, and comment below if you want a video on banding versus surgery.